I'm only 43, so 30 years is a long time. It gets longer and longer every time he tells the story. It's like a fish story. I've been doing it about 25 years. Started when I was 17 as a nurse. So close. So Mark's right, this is the first installment of 4. And in order to build a good house, you have to have a good foundation, right? So we're going to build a little bit of foundation information today, but also give you some good practical information that you can use for a lot of the health, medical related emergencies. The next class is going to be more about trauma related stuff, broken bones, bleeding, fun stuff like that. And then the last 2 series are going to get into some more advanced techniques, medications, how to use them properly, when to use them, when not to use them. Herbal supplements that you can use, botanical medicines instead of pharmaceuticals. And because of the nature of the, not sensitive, but to the high level medical information that you're going to be receiving in these classes, there's a waiver disclaimer at the end that we're going to give to you. That we're going to browse over here with a slide real quick that basically says these classes are not intended to replace medical care, okay? We don't intend for you guys to not see doctors when you need doctors. These classes are for information purposes only, and use the information with your judgment and at your own risk. Whew. And that's what this slide says.
Hey, some of your trainees are across the street right now, Josh.
Yep. If you see a Gold Cross ambulance, I've taught most of them over the last 10 years. Okay, so first disclaimer, I'm not a doctor. I don't claim to be a doctor. I am a very well-educated person, very experienced person in the healthcare system, paramedic, nurse, clinical herbalist, almost done with that one. But I'm not a physician, so the information that I give you needs to be taken from that perspective. Anybody here a licensed practitioner of anything? Darn it. CNA, okay. Do what you can within your scope with the information that we give you, okay? But with this thing, keep in mind, if you use information like we're going to cover today on people that are not in your immediate family, you can be charged with practicing medicine without a license. So the one caveat we want to give you guys is to remind you to use the information you have here today with your immediate family only. Okay? Yes, sir?
What about in case of some kind of accident or injury?
We're about to get there. In a super disaster, there are no services. You can use skills that you have, but keep in mind, because you're not licensed to use them, you can be sued for that and they can win. The Good Samaritan Act protects you as long as you are doing normal, basic first aid type things. Some of the things we're going to cover in these classes are not normal, basic first aid type things. Okay, they're more advanced things, more topics, more medical practices. So yes, you can be held liable for them. The Good Samaritan Act does not protect you if you're starting to practice medicine without a license. Okay, so these really are more for informational purposes. We don't want you to not seek medical care and advice. These do not replace it. So before you start to use anything you learn in these classes, talk to your regular licensed care provider about it first. With that, and that's the legal things I have to say. Okay? Any questions about that? All right, so once you have the knowledge, you can use it however you see fit. We do ask that you hold myself and Mark and well prepared blameless for your choices. Is everybody okay with that before we keep going? All right, wonderful. So if the purpose of the class is not to teach you to be mini doctors, what is the purpose of these classes? Why are we taking these if we can't use the information, Josh? Well, one thing, we want to share the information and knowledge with people. The other thing is, the more that you know about healthcare and diseases and how they're treated and how to take care of them, the better you can take care of yourself and your family. So it's going to increase your own personal health. And a lot of the things that we're going to talk about today, people dealt with every day on a regular basis. Well, according to some scientists, thousands of years, and according to others, about 7,000 years. But we don't do that now. We get sick, and what do? Where do you guys go when you get sick? To a doctor. And if they're not open, where do you go? Oh, Instacare. I love that. Usually I hear ER. Our ERs are so overwhelmed with stuff that could be taken care of at home if you had just a little bit of knowledge. So one thing that I want to do with these classes is to share the knowledge that we have as healthcare providers, because I've worked in ERs from Primary Children's Hospital to American Fork to Florida, St. George, all over the place. And we see a lot of people that if they had the knowledge themselves, they wouldn't be there. But they just don't know. So we want to help you take responsibility for your own health. And probably the most important thing, and when I was talking to some of the doctors in the community about teaching these classes, at first they were a little hesitant, like, I don't know if we want you teaching this stuff to people. But they realized that if you're able to recognize when you do need a doctor, you're going to get better health care. And in the self-sufficiency movement, we have a lot of people who are wanting to do self-care. They go online to diagnose themselves with disorders, and they're taking medications or supplements, and they're never seeing a licensed practitioner, and they're not necessarily doing it correctly. So just as much as having the skills to help take care of your own health is having the skills and the knowledge to know when you do need to go see a licensed provider. All right, so some of the medical things we're going to talk about today. We're going to talk about triage. Anybody ever heard that term before? Mm-hmm. Yeah? Anybody speak French?
If you watch MASH.
If you watch MASH. I loved that show. As a kid, that was that and Star Trek. Good grief. Anyway, so triage and a sample history, and they're all abbreviated for a reason. We'll find out here in a second. We're talking about heart attacks, diabetes, allergies and asthma, and shock and volume replacement. Volume replacement, we're not talking about muting your TV or something like that. We're talking about blood volume, fluid replacement in your body. So to start off with, let's start with triage. It is French, and it means to sort. And this was always the most fun part of my job when I responded to any type of car accident or a fire or rollovers or disasters that we responded to, building collapses, hurricanes, earthquakes, mass shootings, was triage, because you get to decide what happens with people. And as we'll learn here in a second, I have a joke that goes with the next section that you guys ought to kick out of it after you know what we're talking about. So when you start to sort people that need medical attention, the first question you should ask yourself is, what kind of needs does this person have? What type of treatment do they need? The second question is, what resources do you have to take care of those needs? And the last one is, can you meet those needs with the resources you have? So once you get those first three questions all in your mind, this next section, the categories, will start to make more sense. And this is an international color system, by the way. It's come up to help you identify patient or injury severity. So you've got red, and you can use duct tape, magic markers, permanent markers, whatever you've got. You need to mark this person somehow, some way with a color. And they make wonderful little kits that you can get off the internet that have cards or colored ribbon tape or marking tape or spray paint. I like the hairspray better. It washes out. Some way to mark people with the color. So red, serious life threat that you can fix or that is fixable by somebody. Yellow is they're hurt, it's serious, but they're going to live. They're not going to die right now. Some examples might be things like broken bones. You're not usually going to die from a broken bone. It's painful, it's horrible, it's very disturbing, but you're not going to die from it. Green, These are the hurt but can walk, talk, and help. One of the first things you do when you walk up onto a situation where you've got a lot of people that are hurt is you say, hey, anybody who can hear my voice, come on over here, we can help you. Anybody who can get up and walk over there is your lowest priority. Okay? I don't care if they've got cuts, bruises, burns, broken arms. If they can walk and they're thinking clear enough that they can get up and walk over to you, you now have helpers to help you take care of all those people who are more sick that can't do those kind of things. And then you have your black tags. These are your serious life threats that we're not going to be able to fix with the resources that we have. This does not mean that this is dead people. These people can be alive, but you're not going to be able to take care of them. And to help you decide that is this wonderful little decision tree that they've come up with. And the first step is to call for help. You're going to need help. Can you guys read that from back there? Yes, ma'am.
Before we go on,
Sure.
will we have access to this?
Yes, you will.
Okay, so we don't need to sit here and write.
You
the
do
whole
need to
time?
take notes, but you don't need to copy it slide for slide.
Okay, thank you.
Yeah, we'll put it online for you so that you can see it. If you Google start triage in, the search engine, these things will pull up. It's a very commonly practiced thing. In fact, I don't wonder if this will work. Oh, nope, I'm gonna have to do it with my mouse. To show a little bit of how dark my humor is, who's watched Monty Python before? Okay. This is a scene, oh, the lighting here is terrible, where he's chopped off his arms. We'll call it a draw. As you're going through your different levels, how do you think you might assign the Black Knight?
Not fixable.
Not fixable? He was doing pretty good with one leg. All right, so the decision tree starts off with, the first thing you want to do is anybody who's able to walk, you're going to tag them green. It doesn't matter what other injuries they have. They could have a piece of tree stuck through them, or broken arms, or cuts and bruises and bleeding.
Concussion?
Yep. Concussion, doesn't matter at this point. Now keep in mind, your colors can change, but you're going to start them at green. If they can walk and talk and do things, they're fine. They're what's called non-emergent. They're safe. They're going to be okay. They still need care. You still need to take care of them, but they're not a high priority, not an emergency right now. If they can't walk, come over to you. The first thing you want to do is see if they're breathing. And this is where the little mnemonic over here comes into play. 30 and 2 can do. Are they breathing? If the answer is no, are they going to live?
No.
Anybody here can live without breathing? Not for long. Okay. So, exactly, about 3 minutes without air. So we're going to do a real simple maneuver where you tilt their head back and see if they can breathe on their own. And if they're not going to breathe on their own, they get black tagged. This person may have a pulse. This person may not have any visible injuries. But if they can't breathe on their own, and you don't have the resources to take care of that one person and not take care of everybody else, it's a hard decision to make. You're going to black tag them. You can come back and reassess them later, but you're going to black tag them. They have a need that we can't take care of. But if they do start breathing on their own and stay breathing without you doing anything, then they have a really serious problem. There's something not right with them. They need medical attention as soon as possible. So they're a high priority. They get marked red. So the first thing, 30 and 2, are they breathing? And then the next part is it more than 30 times a minute? So if they're breathing, but they're breathing that fast, that's not good either. Make them a red tag. So that's your first differentiation there, is 30 breaths per minute. If it's less than that, they're okay. Let's keep going. Next down here is blood circulation. Who's ever pushed on your fingernail and had it turn white? Go ahead and do it for me. I want you to see it. When you push on a fingernail and it turns white and then let go, how long does it take to turn pink again? Pretty quick, right? About 1 second or less. That's good. If you're not circulating blood very well, your heart's not working right, or you've lost a lot of blood, it'll take longer than that. Or if your hands are really cold, so be careful about that one. Okay? But you want to push on their fingernails, their earlobes, their lips, someplace where you can see those blood vessels really close to the surface. And if it takes longer than 2 seconds to turn pink, there's a serious problem going on in their body. That's where the 2 comes in. Longer than 2 seconds, they get a red tag. If it's less than 2 seconds, you keep going down. Last one down here is mental status. This is what we're talking about as how well their brains are functioning, how well they're thinking. So if they're able to talk to you coherently, they're not confused, they're not thinking they're 4 years old, they don't know what day it is, we'll be careful with that one. Okay? But you want to see if they say, do you know who the president is? Most people know that one.
Do we have to?
No, it is just a choice. You can say, hey, what's your name? And if they go, that's not a good response. Okay? You should know what your name is. What time of year is it? What's your favorite anything? If they can think straight, then they're okay. They may have injuries, they may have problems, but they get a yellow tag. If they can't think straight, then they get a red tag. So to make it really simple to remember, 30 and 2 can do. If they're breathing less than 30 breaths per minute, their cap refill, circulation is less than 2 seconds, and they can do things, they're yellow. Everybody else is red, black, and green. Any questions about that so far? And again, this is just when you have a lot of people. When you got one person, it's much easier to take care of them. And we'll cover that here in a second. But I wanted to get you over with the, if a disaster happens, how do I help the ambulance? How do I help the firefighters? How do I help the hospitals? The more of this that you can do, sorting people into piles or groups, the more of that you can do before they get there, the much easier it's going to be for them to get the care that they need. So any questions about start triage? Okay, good.
Yeah, I do have.
Yes.
32 can do.
Uh-huh.
So you're saying if somebody has pulse over 30 times per minute.
Breathing.
Breathing.
Sorry. Yeah, breathing over 30 times a minute. You're not even checking the pulse. Because they've shown that most doctors and nurses can't accurately check pulses. So we're not going to try to teach you to do that.
If the pulse or the blood return is low as 2 seconds or whatever.
Yep, longer than 2 seconds.
They can give their name. They're yellow or
Yep, they're
all
yellow.
of them, it's yellow.
If they pass all of those, they're yellow. If they fail any one of the 3, they're red.
Oh, okay.
And if they're not breathing, they're black. And if they can walk around and talk and do things, they're green. You'd think green, go, get them first, but no, that's not the case. Green means they're okay. Good question. Any other questions or clarifications? So let's practice it. You feel free to ask me any question about these people that you want to know. Here's your first person. You got a 12-year-old child who has a 3rd-degree burn to their arm. They've got cuts on their face and arms and legs. And they're crying in pain, and they stumble up to you and crying for help.
Green.
Everybody agree with green? Everybody disagree with green? If it's just one, we're not using this system. So it's more than one at least.
Third degree is pretty serious.
It sure is. That's all the way through the skin, down to fat and to muscle and bone.
What if that was,
So, possibly yellow.
They're green. Are you going to die from that burn right now? If you're thinking, okay, that you can come up and walk and say, hey, I need help, this hurts, you're okay for right now.
How large is
Doesn't matter.
the whole arm?
Doesn't matter.
Doesn't matter.
If you've got more than one person to take care of, and they're able to come up and say, this hurts, help, I need help, they're not dying right now. The person who can't get up is dying right now. They need our attention. That's why I used a 12-year-old. I knew there was a mom in here that would just, get a heartstring. Green. All right, I've got a 28-year-old adult. This person is laying on the ground. They're not breathing, and they don't start to breathe after you tilt their head and open their airway. But they've got a slow pulse. But they don't respond when you shake them or tap them. But they're alive.
You said black for now.
I love giving out black tags. I'd walk around, you're a black tag, you're all gonna die.
Well, I'm taking it off.
If you can take it off, then you don't need a black tag. If they can say, hey, what's this black tag mean? You might want to change the color.
Question,
Yes, ma'am.
would you prop them so that their airway stays open just in case?
If I can, but you want to take 30 seconds or less to do this.
Yeah.
Hey, are you awake? Are you breathing? Black spray paint. Next person. That fast. In a big disaster. If you got one or two people, you can take a little more time. All right, what about a 75-year-old adult complaining of chest pain? My chest hurts. I'm having trouble breathing. And I've had 3 heart attacks and bypass surgery in the past. And my skin is really pale and sweaty. And it's cold to the touch. Why?
Trouble breathing.
Okay.
It's serious life threat. They could be dying of another heart attack. They're pale and sweaty. They could be in shock.
Mm-hmm.
But
But they're still walking, talking, thinking. Why not yellow?
Well, if their breathing is more than 30 per minute, probably is if they have trouble breathing.
Yeah. So the breathing is going to be the key on this one. That circulation. So if they're already pale and they're sweaty and clammy from that shock, going into shock, if you push on their fingernail, it may not turn pink at all. So they're probably going to fail that 30 and 2 can do. But that's how you tell somebody who is walking and talking and in pain from somebody who needs to go right now, first. So yeah, it's a good one. So what was the final consensus, red or yellow? Red? Good. What about an 8-year-old child who was trampled by a crowd? Something went off, blew up, whatever, and everybody ran out, and this poor little kid fell down and got stomped on. They've got a broken arm and a broken leg, and cuts and stuff all over their head and face that are bleeding. Very confused and crying.
yellow?
Red because of the confusion, the mental aspect.
But were there 8? Isn't that kind of expected?
I don't know.
They're trampled by a crowd. I was thinking
Yeah,
8-year-old
trampled by a
were-
crowd is liable to make anybody a little bit confused.
A little confused.
Were there 8?
They're not ambulatory.
Yep, they can't walk, so they're not green.
I'd say red.
Do you want to know any more information?
Yeah.
Like?
Need more information.
Well, yeah, I want you to ask more
Because
information.
they're breathing correctly, because they're crying.
Well, they are breathing. How fast are they breathing? So if it's
When you say confused, do they still basically know their name? And
okay, they know their name. They just don't. They don't know what happened. They're scared. They don't know where mom and dad are. I don't know what's happening.
Well, that's different.
Yellow.
I'm confused. What's happening? What's going on? What's your name, sweetie? What's a good gender-neutral name? Chris.
Well, we have to ask about the perfusion. How's the perfusion?
Oh, it's less than 2 seconds.
How's the breathing?
Trampled by the crowd, there could be internal injuries.
Uh-huh.
I don't think if they're passive breathing and.
How's the breathing?
Know their name,
Yellow.
Yellow tag, you could upgrade them later.
Okay, that's what Boy is waiting for. If it changes, you can always change the color. For right now, they're yellow. But they got broken arms and broken legs. They're not going to die from that right now. But they're bleeding and they got cuts on their face. They can live with those for a while. All bleeding stops eventually, right? All right. So good. Any questions about those? I like the questions you're asking. It tells me that you're thinking about what's going on. All right. So once you get these people all sorted, or you've got just one person you're helping to take care of, you're going to need some information about them. And a good mnemonic to remember it is called sample history. And the S stands for signs and symptoms. What's wrong? What's going on? As a paramedic, did it all the time. I'd walk into a house, and well, it was fun in Florida. My partner, but I would say, "Hey, what your problem is?" And I try to be a little more polite. "Hey, what can we do for you today? Why did you call us here at 2 o'clock in the morning?" Find out what's wrong. "Oh, my stomach hurts, my head hurts, my arm hurts, I'm dizzy, I'm lonely, my cat's stuck up in a tree." Whatever the problem is, find out what is a big issue for them. And keep in mind, you may think it's not serious, but to them, it's the whole world. That's why they're coming to you for help. Because they can't take care of it themselves.
Sounds like teenage girls.
And teenage boys. We pick on everybody here. We're like South Park and The Simpsons. All right, next one is allergies. Do you have any allergies to anything? Is there anything that you can't have before I start trying to take care of you? I don't care if it's food allergies or seasonal allergies or medication allergies, or if they can't remember and go, I don't know, but when I had this one antibiotic, I didn't do very good. Guess what? You're not going to give this person.
What about latex allergies if you
Don't use latex.
Don't use latex anymore.
Latex pretty much isn't used anymore. It's all nitrile. So if you've got gloves, which you should, in your first aid kits have gloves. Yeah, people with latex allergies, it's really not an issue anymore. Yeah, we won't go there. So any allergies, even if it's like, yeah, I get hay fever. Because if you start trying to use some herbal supplements to take care of these people, those hay fever and plant allergies and food allergies do become important. So don't discount those. Any medications, herbs, or supplements that they're taking, whether it's legal or not. I used to love getting a patient saying, "Hey, man, what drugs you taking?" "No, I don't do drugs." Yeah, okay, now seriously, what drugs are you taking? "I'm not the cops, I don't care. I just need to know so that if I give you this to help with your pain, it doesn't kill you." Anybody ever see that movie, As Good as It Gets, with Diane Keaton and Jack Nicholson, thanks. And he's in the hospital and he's like, "Oh, I'm fine, doc." He goes, "Okay, good. Because if you're taking any male performance enhancing drugs, this medicine will kill you." And he pushes the medicine in. And Jack Nicholson rips the IV out of his arm because he was taking those kind of pills. But he didn't want to admit it. People are not going to want to admit if they're taking illegal drugs or some supplements. So make sure they understand that you're a safe person. You're not going to tell anybody, but I need to know if I'm going to take care of you, what you're taking. So if they have some issue and it hurts, and they've been drinking a bunch of booze to help kill the pain or to help them sleep and they can't sleep, you want to know that before you start trying to take care of things. Past medical problems. This is any kind of medical problems, and we're looking for stuff recently. I used to always be careful when I asked this question of little old ladies, because I would get, well, in 1927, I had chicken pox, and it really itched. No. Today. What's wrong? Today. Have you been to the hospital in the last year? Are you under the care of a doctor for anything? Find out some recent medical history. Some of the older stuff may be important, but you're going to find out more of that later on as you ask more questions. The last meal that they've had, what they had and when they had it. Depending on what's going on, if they've had food or drink recently, they can't go to surgery because they'll throw up and choke on it. It complicates the surgeries. So don't give them anything if you can help it, but find out what they've had and when they've had it. That way when the ambulance shows up or you get them to the hospital, you can tell them, hey, they've had this and this and this, they have these allergies, these medications, their last food was this, and you can be a huge help in taking care of this person. And then find out what was going on in their lives right about the time this happened. The events leading up to what happened. Hey, I fell and hurt my back. Okay, what were you doing when you fell and hurt your back? Oh, I was on the top of the ladder trying to change the light bulb up here on the second story on the spotlight. As opposed to, well, I was walking down the steps and I slipped on a patch of ice. Is there a difference between the falls? Yeah. So you want to know kind of what the story was going on before they had a problem. The next thing we want you to get is some really simple vital signs. And by vital signs, we mean heart rate, breathing rate, blood pressure, temperature, and what kind of condition their skin is in. Anybody here besides the CNA know how to take a blood pressure? You will when you leave here today. Okay? It's really simple. And this you might want to take notes on. Everybody, do me a favor. Take a finger and put it here along your wrist. Right here at the base of your thumb, you'll feel kind of a bump on the bone. All right, now take your finger and slide just on the bottom of that bump, on the inside of your wrist. You should feel a pulse. Don't use your thumb to do this. Use a finger. Do you feel a pulse? A little thump, thump, thump under the skin? Okay. In order for your body, your heart, and your blood to be able to get enough blood to pump and get pressure to make you feel that pulse here on your thumb, at the base of your thumb, your blood pressure is at least 90. Everybody know what your blood pressure readings are, right? What they kind of mean? Usually you get a number 120 over 80. Have you guys ever heard these numbers before? This top number is the pressure inside your blood vessels when your heart is pumping, when it's a high pressure. This bottom number is the pressure inside your arteries when your heart is relaxing and refilling with blood. Okay, they have really big fancy names. We're not going to worry about them today. Right now, what I want you to know is that if you can feel this pulse right here at your wrist, your blood pressure is at least 90 when the heart is pumping. That's good. That's generally considered a safe blood pressure, one that will sustain life. Ready for the next one? All right, make a muscle. And you're going to feel the top muscle and the bottom muscle in your arm. And between them there's a little soft spot. Okay, take your fingers and slowly push in that soft spot and kind of wiggle your fingers around a little bit until you can feel a pulse. You can, it's just really hard. If you can't do it on you with your clothing, find a neighbor. We're going to touch each other.
Oh, no, not that.
I know, right? Everybody got a pulse right here in the arm? No, that's because you're dead. We're gonna black tag you. Right there. You feel it? Can you feel it on your arm? All right, put your finger right there. It's kind of faint through your shirt, but I know what I'm looking for. Here, try it on me. Right there.
Sorry, you're dead.
I'm dead too.
Yeah, I'm dead too.
All right. Hey, I told you, most doctors and nurses can't do this. So if you can do it, you're better than 9 out of 10 doctors and nurses. But if you can feel a pulse right here, if you can feel it, then you know that the blood pressure is 70. If you can't feel it, that doesn't mean that it's not 70. It just means that you can't feel it. But if you can feel it, you know that it's at least 70. And again, this is barely supporting life, not good for the person. Last one. Find your Eve's apple. I call it an Eve's apple because she gave it to Adam and he choked on it. All right, find your Eve's apple. Turn your head to the side. And you feel that muscle right here in the front that kind of stands out when you turn your head to the side. I want you to feel between your Eve's apple and that muscle. There's a little notch. It's your carotid artery. This is one that feeds your brain.
Feel that one.
Good. You're not dead all the way. You're just mostly dead.
Princess Bride.
Yes, it is. Woo-hoo-hoo. Look at those so much. All right, if you can feel this pulse, this carotid artery pulse, then your blood pressure is at least 60. 60 is the bare minimum it takes to support life in your brain. Your liver and your kidneys are going to shut down. You're going to die in a few weeks anyway. But hey, at least for right now, your blood pressure is enough to keep your brain alive.
But they can't walk.
These people are usually not walking and talking, they're laying on the ground, or dizzy and passing out, things like that. So real quick, easy way to check some blood pressures is that if you can feel the pulse, do I have permission to touch your body?
Sure, go ahead.
Thank you. What movie is that from?
I found that one, by the way.
Did you? Okay, good. It's Hancock. Yeah. Do I have permission to touch your body? All right, so if you can feel this pulse, their blood pressure's fine. It may be 180, but they're alive. It's enough to support life. If you can't feel this one, but can feel this one, then you know they're not doing very good. And if you can't feel this one, go straight for the neck. How can an attack move? Hey, I can't feel that. Go in for the neck, check that carotid pulse. If you can feel that one, they're barely alive. We need to do something to fix whatever's going on with their blood pressure.
Are those all the top number right there?
These are all top numbers. I don't want to say the bottom number doesn't matter, but at this point in your level of training, the bottom number doesn't matter. We're only concerned with that top number on how well you're staying alive, if you're able to stay alive.
If they're bleeding a lot, then they probably don't have a bottom number.
Well, they do. It's just going to be 0. 0 is a number. It's the loneliest number. Oh, that's 1. Okay. Good questions. Any more questions about blood pressure? And the way that you write this down for somebody in medicine would be 90 over P. And it stands for palpation. It means you did it with your hands. Or you can think of it as pulse. I checked a pulse and their pressure was 90. I checked a pulse and their pressure was 70. I checked a pulse and their pressure was 60. Does that make sense? Okay. Good. Any questions about that? Heart rate. How do you think we're going to get their heart rate?
The carotid wave, the most
Okay.
accurate.
Is the most accurate, but if you start grabbing somebody around the throat and you don't know them really well, are they going to take that very well? No. So usually if you can feel this pulse, you're checking for a pulse anyway, right, to see if they have a blood pressure. Well, if you can feel one, I go, okay, cool, I'm going to start counting it. Who still wears an analog watch? Yeah, shame on ya. Who has a cell phone with a stopwatch or a timer on it? Do something. Look at a clock, look at your watch, count it for a full minute. Count how many beats you feel. So that will give you heart rate. What about breathing? How are you going to count that?
Put your hand on your chest.
Okay, be careful with that one. Well, be careful with that one too. And you don't want to tell them what you're doing because then they're going to start thinking about their breathing. But yes, you can either A, take their hand as you're checking their pulse and put that on their chest and feel it move up and down as they breathe. That way they don't feel like you're groping them. Or you can sit there and watch their chest. And as long as you're holding this hand, what do they think you're doing? Checking a pulse. They're not thinking about their breathing. But I guarantee you, as soon as you start thinking about your breathing, you're going to start controlling your breathing and changing it. So don't say, hey, I'm going to watch and see how fast you're breathing. Oh, don't do that. I get anxious when you do that. But count how many times they breathe in a minute. So now you have, I'm going to call it breathing rate instead of respiratory rate. And we have blood pressure, temperature. You guys carry a thermometer? How about, oh, we're about the same temperature. I don't think I have a fever. Do you have a fever?
No.
Oh, okay. He's about 98.6 degrees.
But if you're cold, if you're outside the cold,
That's not going to work, is it? So what do? Feel under the clothes, armpit. Ooh, that's going to be hot and sweaty anyway. What we're looking for is kind of hot or cold. Oh, woo, you're hot to the touch. And then I'm going to check somebody else and compare. Oh, wait a minute, I'm hot to the touch. Maybe that's not so accurate. Oh, you're hot to the touch. Maybe my hands are just cold. Get kind of an idea of a temperature. Or if you have a thermometer, thermometers are really cheap. They're like $9 at Walmart. Stick them in your ear, rub them across your forehead. If you're going to start having, providing care for people in your family or yourself, you might want to invest in a thermometer so that you can get accurate temperatures. For temperature, anything over 100.4 Fahrenheit or 38 degrees Celsius is considered a fever. Anything less than these numbers is not a fever. Oh my gosh, their temperature is 99.8. Guess what? It's not a fever. They're hot, but it's not a fever. And fevers are not bad. Fevers are good. Fevers are your body's way of trying to heal itself. So don't give them Tylenol. Don't give them ibuprofen to get the fever down. Let the fever go. We don't even consider treating a fever until it's above these numbers. And then it's usually, take some of the blankets off. Yes, sir.
what is the upper threshold before you would consider starting to do something about it?
This is it. This is when I start thinking about doing something about it.
Above 104.
100.4. Yep. If it starts getting into the 101s or greater, then I'm going to start thinking about medicating it with Tylenol, ibuprofen, or cool damp cloths, cold compresses in the armpits and necks, something to start bringing the temperature down. But keep in mind, if you change the body's temperature too fast, you can cause a seizure. Who's heard of baby seizures, fever seizures, febrile seizures? At what point do you think they start having a seizure from their temperature?
My daughter had them anything over 100.5.
Good. I usually get, 104, 106. Guess what? It's not about how high the fever is. It's how fast it changed temperature. So if they went from a normal 98.6 to 100 really fast, they can have a seizure from it. If you go from 100 back to 98.6 really fast, you can have a seizure from it. So be careful about changing temperatures really fast. But as far as fevers go, if it's not 100.4 or 38 Celsius, 0.0 Celsius, it's not a fever. Don't worry about it. Let it go.
In swinging in the opposite direction, in the case of a person with hypothermia, you kind of warm them up too fast, could that cause a seizure?
Yep. Any rapid temperature change. The brain just does not like change. Good questions. Any other questions about some simple vitals? Let's practice it. Turn to your neighbor. I'd like you to get a set of vitals and a sample history from your neighbor. Okay, good question. What's normal? Anything between 70, well, that's not true. New numbers now. Anything between 50 and 100 is normal. It used to be 60 and 100, but since some of America is really healthy and some of America is really not, they had to broaden the range. If you have a professional athlete or someone who does aerobics a lot, like I always use Lance Armstrong as an example because most people my age know who Lance Armstrong is. He's a bicyclist. His heart rate when he's just sitting around normal is about 27.
He's a world champion.
He's a world-class aerobic athlete. Mine, usually, when I'm sitting around just, being me, is about 85 to 90. And if I think about getting on a treadmill, it goes to about 130. Okay?
Remember Jim Fix?
I don't.
He's the guy who started the running revolution. He wrote the book about running. Died of a heart attack while running.
Good for him. Doing what he loved.
Yeah, that's,
My husband's a regular.
Remember now.
Yeah, in the 50s. I used to freak out when I said, oh my gosh, you're like 51. And I realized they're sitting there talking, they're fine, they're pink, their blood pressure's fine, it's fine. So what's normal? There's no such thing as normal.
Abby normal.
Abby normal? I have yet to meet her. But good question. Normal range, 50 to 100. How did everybody do? Is everybody alive? Okay, good. I wanted you to practice it at least once in a situation like this so that you get a feel for what it feels like to ask a history on somebody. Actually kind of check a real quick set of vitals. All right, so let's talk about heart attacks. I couldn't resist the little clip. It's too funny. He's getting fired when this happens. All right, so what is a heart attack? Anybody know what a heart attack is? What do you think a heart attack is?
When a blood clot occludes one of the vessels going to the, sorry.
Use normal speech.
Plugs off one of the blood vessels going to the heart, and a part of the muscle actually dies.
Okay.
It's being fed.
Yeah. And it doesn't have to be a blood clot. It can be air, it can be water, it can be amniotic fluid from a woman who just had a baby. It could be a cheeseburger. It could be plaque building up inside their arteries. And sometimes it could just be a muscle spasm that causes that artery. But that blood vessel in their heart, for whatever reason, is closing down and there's not enough blood getting to the heart for it to live. So it dies. And down here at the bottom where it says women are special, that's because women can take more pain than men. So they don't recognize these classic, I'm having a heart attack symptoms. That crushing, oh, I've got an elephant sitting on my chest. Who's ever had an elephant sit on their chest? I want to know what that really feels like. Well, no, I don't. But I want to know how they know what it feels like. But almost invariably, 9 out of 10, maybe 8 out of 10 patients that I've had that have had heart attacks have said, oh, it feels like an elephant is sitting on my chest. There's pressure, it's heavy. Their skin is going to be cool and pale and sweaty and damp. And they're going to have trouble breathing. Now, women are special. They can take more pain than men do. So they don't usually have that crushing chest pain, that pain going down their arm. They just don't feel good.
Don't they have it in different places too?
Usually their back. My back hurts, right behind my shoulder blades. Or I just don't feel right. If a woman ever admits that she doesn't feel right, believe her. Okay? If a guy says, oh, I'm having lots of pain, take it with a grain of salt. Okay? Diabetics are even more special. All that blood sugar in their body, it kind of deteriorates their nerves, and they don't feel things the same way other people do. And a woman who's a diabetic, you're not going to have a clue she's having a heart attack. She won't have a clue she's having a heart attack until she keels over. But that classic, oh, Esther, it's the big one. Oh, you guys remember Sanford and Son?
Yeah.
Okay, one person does.
I remember.
All right. It's the big one, I'm coming. That's classic man pain. And since we're a male-driven world, that's what we always focus on. I want you to focus on some other things too. Women just don't feel right, maybe have back, shoulder pain. And if they're diabetic, man or woman, they're not going to have the right same symptoms either. But that's the classic heart attack signs and symptoms. Yes, sir.
You said it was because the artery closes down?
Mm-hmm.
That's the cause of the heart attack?
That's the cause of the heart attack. For whatever reason, whether it's a blood clot or fat collecting, plaque collecting inside the artery and slowly getting narrower, 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 whatever the reason, that artery, or a muscle spasm closing down on it, that artery is not letting blood get through.
What could cause a muscle spasm?
Lots of things.
Oh.
Lots of things.
And a stroke is one of the brain.
What's that?
A stroke
Is in the brain.
is in the brain.
Is in the brain.
And the heart attack equals atrial fibrillation. What's that?
Not necessarily. Atrial fibrillation is a special kind of heartbeat where the top of the heart doesn't beat, but the bottom part does. So it's really easy for a blood clot to form in the top. And it's really easy for them to get a heart attack or a stroke. But anything that causes that artery to not flow blood causes a heart attack. It dies.
Watch the movies and somebody gets a huge shock in their life and kills over dead with a heart attack. Is that
It's Hollywood.
Hollywood?
Is it possible to die of shock? Shocking news. Yes. I'm not going to say anything's not possible. I mean, they've got men having babies.
What?
Yeah, whole other story. And I don't mean transgendered. I mean physically, anatomically, genetically male having babies.
Oh, we'll have to talk about that after.
Okay. So how do we take care of somebody that we think is having a heart attack? Well, the first thing is keep calm. I mean you, not them. And then keep them calm. Because the more you get them excited, the more their heart's going to race, the more it's going to kill their heart. The more calm they are, the better. Then call 911. If you can't call 911, well then we move on to the rest of the stuff. Nitroglycerin. Who's heard of dynamite? Guess what it's made out of? Nitroglycerin. It's the same stuff that they carry around in their pocket, in their purse, in their wallet, in their glove box, and they pop under their tongues when they're having chest pain. There's a reason why we use an explosive. It's because when we figured it out, when people were carrying dynamite that was old and the nitroglycerin was leaking out, as they were carrying it into the mine, they'd pass out because their blood pressure would drop and they'd pass out and they'd die in the mine or have somebody to go and get them. So we discovered that if we use nitroglycerin and we dilute it down with water, it doesn't explode anymore, but it still drops your blood pressure. It makes it easier for the heart to work. Yes, sir.
Is aspirin still a method?
I can't believe I didn't put it on there.
Okay.
Anyone getting a heart attack should get a baby aspirin. If you don't have a baby aspirin, use a regular aspirin. But don't let them swallow it. They need to chew it up and hold it in their mouth, either in their cheeks or under their tongue. It tastes terrible. I'm talking bitter, dry, pucker your mouth, terrible.
Okay.
They're going to want
There's
to...
no picnic.
Well, we're going to get to that one here in a second. Nitroglycerin. If they have nitroglycerin prescribed to them, help them take it. Help them put it under their tongue. As long as their blood pressure is 90 over. How do we tell if their blood pressure is 90 over? If you can feel a pulse at their wrist, it's okay for them to take their nitro tablets. If you can't feel the blood pressure, the pulse here at their wrist, don't let them take their nitroglycerin tablets. Because what does it do to your blood pressure? It lowers it. Lowering it makes it easier for the heart to pump, but it also makes it easier for you to not get blood to your brain and your heart. So be careful. Do CPR, get ready to do it if needed. It's a whole other class. But get ready to do CPR. Well-performed CPR when someone has had a heart attack and died increases the chance that they will come back to life with the first shock that the paramedics give them 90 to 100%. For each minute that CPR is not being done, that goes down 10%. That's from American Heart Statistics. Okay, so if they go 10 minutes without having good CPR being done, and it takes 10 minutes for the ambulance to get there, what are the chances they're going to come back with that first shock? 0. They're going to have to do things first to try to get them back to life. But if you can do CPR, you increase that 90 to 100% chance they'll come back with the first shock. And you don't need to wait for an ambulance. There's these machines called AEDs. Have you guys heard that term before? All over the place now. They really are firefighter friendly. They are idiot proof. Okay? Anyone who can hear and has at least one arm can use one. And if you're really good with your toes, you can use one. All you do is turn it on and follow the instructions. It will tell you exactly how to use it.
What's it called?
An AED. Yep. Stands for Automated External Defibrillator. Big fancy words for the heart is shaking and quivering, not pumping. And this is going to shock it and get it to restart and pump again. It's going to reset it.
It's just the same, when you say that they're all over if you know where they're kept and where, somebody does have one or a facility has one. So if there's a place that you are at on a regular basis frequently, like work or something like that,
Ask.
volunteer something, ask and find out what's available and where it is, and if it's kept under lock and key.
Right. Or if it's been tested in the last 10 years. Every grocery store, every public building, every police officer vehicle, every library, most gyms, airports, theaters, pretty much anywhere you go, it has one. It's not required by law, but it almost is. They've all got one.
Maybe we should get one here.
Yeah, we should probably get one here. The cost has come down pretty reasonable. They're actually down to about $300 a piece now.
And they also monitor your heart
Mm-hmm.
to know when to stop shocking it.
Yes. They will only shock it if it's a heart rhythm that they can actually fix. If you guys have all seen the TV shows where they have the little heartbeat and then it flatlines and they go, oh, let's shock them. Guess what? That's the one you can't shock. Anything else besides this and this, it can shock. Basically. It knows when it can and can't do it. Just let it do its thing. It'll tell you what to do if it can't shock. It'll say start CPR. And then it will tell you how to do CPR. They're amazing little devices nowadays. All right, so get ready to do CPR. Yes, sir. It'll be a voice that says, connect electrodes. Peel the packages open. Pull out this color pad and place it at this place on the body. Connect the other pad. Plug it in. Don't touch them.
Yeah.
I'm going to analyze them.
Stand back.
Stand back. Shock advised. I'm going to shock in 3. 1, 2, 3. Don't touch the person. Shock. Shock delivered. Resume CPR. For instructions on how to do CPR, press the flashing orange button. And it'll tell you how to do CPR. I've taught that class a lot. I've had to be the voice a couple times. About $300 for a cheap one. They go all the way from $300 to about $2,000.
And you use them when?
Only on dead people.
So if their heart has...
No pulse, no breathing. All those black tags we were doing, you can use them on those.
And then that flat line.
That flat line won't work.
Well, if they're...
The way that okay, we'll take a little bit of time. The way these machines work. No. Good question. All right. All these little pictures that you see here that means a heartbeat, all it is measuring is the electrical activity that's happening inside the heart as it fires. Okay? Think about these machines as unplugging your computer, plugging it back in, and restarting it. If your computer is already unplugged, or there's no power, there's no electrical activity going on, is turning it on going to do any good? Is restarting it going to do any good if the power's off? If your house power is off, will your computer restart?
Nope.
No, it's not going to restart. Same thing with your heart. There has to be some sort of electrical activity happening in the heart for that shock to reset it and give it a chance to work like it's supposed to.
So it's going to sense that with its own sensor?
It sure does.
So even after someone's heart has stopped, there's electrical activity for a while.
Yep, there will be in fact, usually when there's no pulse, it looks like that in the hospital. That's when we shock all the time.
So how long can that go on?
About 10 minutes. Give or take. If you do CPR right away, as long as it takes for the ambulance to get there or an AED to get there. But there's all different kinds of heart rhythms. They don't really matter. The machine knows what it can shock and what it can't shock.
Is there a huge difference in the quality of the AEDs? I mean, I'm sure you get fancier, heavier duty casing, whatever, between like a $300 machine and a $2,000 machine? Or is it just like durability of what would work best on an ambulance versus what would work best in the home situation?
Does a Vespa still drive?
Yeah.
Does a Cadillac still drive, or a Lexus, or a Lamborghini still drive? Or a Harley? Better compare. No, it's not a good comparison because Vespas and Harleys are about the same. They're always breaking down.
Mine haven't.
Good for you. A Vespa and a Harley. Are you going to get bells and whistles with the Harley? Yeah. Does the Vespa drive from point A to point B? Yeah. They all have to do the same job or else they can't sell them. But you're going to get more bells and whistles with a more expensive model.
But you'll still get the voice commands and
Yeah.
the basic.
The basic things that you need.
But just to back up a minute.
Sure.
CPR starts the electrical activity.
CPR
Keeps the blood flowing.
keeps the blood flowing, and it keeps an environment where the electricity can start going.
Keeps your blood oxygenated.
Ish. It's more not so about the oxygen, it's more about removing carbon dioxide. That's why we breathe. We don't breathe to get oxygen. We breathe to get rid of carbon dioxide. So when a heart has a problem and it's not getting blood, yeah, it's not getting enough oxygen, but the biggest problem is carbon dioxide. And because it's not leaving, it's creating an acid called carboxylic acid, which is killing the heart, or any muscle, or any part in your body. So really the problem is getting rid of that carbon dioxide. CPR keeps blood flowing in and out, getting rid of that carbon dioxide, which makes it so that the heart can respond when you shock it. That's why if you're not doing CPR, it takes a while for the paramedics to do CPR before the heart will be able to respond to the shock.
Get that CO2 out.
Get the CO2 out, get a little oxygen in too, but the problem started because oxygen wasn't getting in. So it's probably not going to get in because the clot's still there, but getting carbon dioxide out. Great questions. And I will go down the rabbit hole with you guys if you want, but I want to keep it up here on the surface. Great questions. So CPR if needed. Now, what is this cayenne water pepper stuff at the bottom? Anybody ever heard of a wonderful little famous or infamous or notorious, take your pick, naturopathic and medical doctor named Dr. John Christopher?
You bet.
Okay. He swore by this. He has got documented cases where he takes a teaspoon of cayenne pepper, mixes it with warm water, and has the person drink it when they're having a heart attack, and it stops the heart attack. Cayenne pepper has got some really amazing properties where we talked about what is a heart attack, right? It's a blood vessel with a blockage. Cayenne pepper, the chemicals in cayenne pepper have been proven to open up those blood vessels and to restore blood to that part that was not getting blood just by drinking a glass.
Relaxes the blood vessels.
It's a smooth muscle relaxer. And hawthorn does the same thing, but particularly in the heart. There's certain receptors in the arteries in the heart that it affects more than anywhere else in the body. So cayenne water and hawthorn tincture taken under the tongue have almost the same effect, if not a better effect, than the nitroglycerin does. Yes, ma'am?
You have cayenne tincture? Would you put it
That
in
will
a little
burn. I would dilute it first.
water?
I would dilute it first, absolutely. 'Cause otherwise, tinctures, hawthorn tincture, you put straight in. But cayenne's going to burn, so I would dilute it.
Mix it with water. And how much did he say for powder? 1 teaspoon?
Again, this is not my measurements. This is Dr. Christopher's, was from a half a teaspoon to a teaspoon.
In a
An 8-ounce glass. Yep.
What is hawthorn tincture?
Hawthorn is an herb. It's actually a tree that you take the bark and the leaves and you soak it in alcohol and you pull out the good stuff and you drop the alcohol under your tongue. So
They're not using the berry part for that?
you can use the berry too, but the leaves and the bark have more concentration of the chemicals you're looking for.
Are these alternatives, not cumulative?
These are,
Like nitroglycerin, aspirin, cayenne pepper?
okay, are these sudden? Okay, you're right. A lot of the times with herbal treatments, homeopathic treatments, naturopathic treatments, it's a cumulative, over time this will help. No, this is instant.
No, I mean, use all 4 simultaneously?
You can,
One or one?
but the same warning that goes with the nitroglycerin goes with the cayenne and the hawthorn. If you can't feel a pulse here, don't give it, because it's going to drop their blood pressure.
Aspirin too?
Aspirin does not. Aspirin you can give.
But would you get aspirin with cayenne and hawthorn?
Absolutely. Yes, you can do them all at once.
Okay.
Yes. In fact, we regularly give aspirin and nitroglycerin to every single heart attack. Oh, you're having a heart attack? Here, have some aspirin. Are you taking any special medicines? No. Good. What's your blood pressure? Okay, here, have some nitroglycerin. Aspirin and nitroglycerin are the 2 things that every heart attack patient gets right off the bat. We used to give them a whole bunch of oxygen, and we found that that actually is not a good idea to do. It causes more problems than it fixes. So we give them low concentration oxygen. So just room air basically is fine.
So their blood pressure has to be at least 70,
90.
90.
90.
Okay.
Feel it here. Feel it here at the wrist before you use nitroglycerin or the cayenne pepper or the hawthorn tincture. But again, I can't recommend that you use those because they're not FDA approved for that. But aspirin and nitroglycerin, absolutely. Great questions. Any others?
So can you just buy nitroglycerin? You can't buy it off.
No. But if you explain to a doctor why you want it, it's so safe, they'll usually prescribe it for you. Like I've gone to my,
I mean, if you just wanted it in your
in your first aid kit, absolutely. Hey, when I have an emergency for my family, I want to be able to have this for them. Talk to your doctor, explain to them why, explain to them how you're going to use it, and if they feel comfortable with you doing that, they may prescribe it for you. Absolutely. Yes, sir.
What kind of shelf life does it have?
Good question. Terrible. The tablets, I don't know how many times I've had a patient that we picked up say, oh, I've taken 10 of my nitros and it's not helping. Well, where do you keep your nitroglycerin? Oh, in my glove box. It has to be kept cool, dark, dry. Hold your finger the right way in the wind. Face south, do your prayers. Face east, do your prayers for it to stay potent. And that's the tablets. So the tablets, not very good. That's probably what your doctor's going to give you. The other option is a spray.
So if you do all of that with a tablet, how long? I mean, there's usually an expiration on it.
The FDA requires everything have an expiration date. The nice thing about nitroglycerin is that it doesn't turn into something bad. It just won't work. It becomes less potent. So Can you try to use old nitroglycerin
What's old?
Over, after you use
after the expiration date?
After just,
Anything after the expiration date, and even before the expiration date. If you're trying to use nitroglycerin, period, put one under their tongue and wait 2 minutes. It'll have an effect within 30, 40 seconds if it's going to work. So if you wait 2 minutes and it hasn't done anything, check their blood pressure. If you can feel that radial pulse or blood pressure above 90, give them a second one. You can keep doing that indefinitely as long as their blood pressure is above 90 and they're still having chest pain,
So you're looking for the chest pain to go away.
or at least diminish. But it's got side effects. They're going to get headaches, they're going to get dizzy, their blood pressure is going to drop, they're going to get nauseated. It just depends on what you want to do. But again, the goal here is not for you to go get nitroglycerin and take care of heart attack patients at home. Okay? The goal here is to educate you that if you have someone who has nitroglycerin prescribed and it's not working, now you understand why it's not working and that you need to do something different than just keep putting tablets under their tongue.
So it's a heart attack usually, like you said, the Hollywood version was they
Yeah.
get a pain and they drop. Is it usually a long process for pain?
Men go for hours with a heart attack because we are too stupid to realize that, hey, that's killing me. Oh, it's just heartburn, it's indigestion. Oh, it's not that bad. I'll take a nap.
So do lots of people have maybe slight heart attacks and
Have them all the time.
diagnosed?
Yep. Or not diagnosed at all. Yeah, people have heart attacks all the time, just like strokes. People have really small strokes. Never go see a doctor. Drove me nuts when my mother did it. Because she would have a small stroke, and then another small stroke, and another small stroke, and another small stroke, until she finally had trouble swallowing.
So what do you mean by small stroke?
A small part of her brain, a little droop, a little bit of a slurred speech, nothing really bad, and it would go away sometimes.
I've had one, but I did have it diagnosed.
Yeah, so
They said it was a mini.
a mini stroke, yep.
So you can have small heart attacks and not even know really you're having a heart attack?
You go, oh, maybe that was just a bad chili burger or something. I had some heartburn. And that part of your heart dies and the pain goes away. And you go, oh, maybe it wasn't so bad. But your heart is slowly dying. Absolutely. So any of these symptoms,
Checkup, can your doctor tell? Just by a
sometimes
kind of test you got to have?
you would need to have blood drawn. And even that's not going to be very accurate if it's old. So there's a few things, but you're talking about advanced cardiology that I really don't have time to teach you today.
So heart attacks can be a long.
They can last a long time before you go, oh, I'm going to die. Okay?
So this cayenne pepper would never really have a shelf life.
The wonderful thing about cayenne pepper is it doesn't expire.
Yeah,
Same thing with the hawthorn tincture.
Doesn't matter how cold it is.
yeah, and you don't need a prescription.
You know, and one of the herbalists that I studied with or studied under and from, Deborah Newsy St. Clair, have you guys ever heard of her? Fabulous herbalist. She says, I've never used it, but if I had somebody I loved that was having a heart attack, I would pour them a glass of cayenne pepper water in a heartbeat. It can't hurt. It can't hurt, and it might help. That's one of the nice things about some of the herbal supplements and things.
So if someone is having chest pains and they are insisting that it's heartburn, and they take a couple of antacids and it does go away, are you safe to
Assume.
that it was just that, or should
Yes.
we still consider
If it's a heart attack, antacids aren't going to fix
going
it.
to fix it?
And that's why I used to love seeing, well, I've taken a whole pack of Tums and it's not helping. Well, that's because it's not, and it's not heartburn, buddy. Your heart's dying. Oh. Well, I took a whole bunch of my heart pills and they didn't stop anything either. Well, that's because you store them in your glove box and they expired 10 years ago. It is just use a little bit of judgment. Again, this is not a how to take care of people. It's a information about what's going on so you're better able to help the situation. Let's talk about diabetes real quick. 2 types of diabetes. Guess what? They both have the same problem. Type 1 is typically called juvenile diabetes because it's an autoimmune disease where your body attacks the part of your body that makes insulin and kills it. And so suddenly you get to the point where you can't use sugar. So the body stops making or doesn't make enough insulin to keep your body going. And insulin helps to get the sugar from your blood into the cells of your body. That's what it does. So you can't get sugar into your cells. That's type 1 diabetes. Type 2 diabetes, your body makes plenty of insulin. The problem is the cells have stopped recognizing that insulin can come in. Some parts of it will let it in, some parts won't. So it doesn't get very much sugar in. So the way that so again, the same problem, you can't get sugars into your cells. So the two types of diabetes aren't the same. They're different in their causes, but the net result is the same. You can't get sugar in. So how do we take care of it? Insulin. Those that don't make it, we give it to them. The problem with insulin is that it's got a very small, short shelf life. It only lasts for a few months, if that long. And you only get a couple vials at a time because it'll expire before you use it. So people who are diabetic, who are type 1s, and need that insulin to live, if they don't have insulin, what's going to happen?
Sugar builds up and kills them.
They're not going to live. There was a study actually produced in June of last year that was done in China and Europe where curcumin and piperine, these are the substances in turmeric and black pepper, actually stimulated new growth in type 1 diabetics. And they started producing insulin.
My cat has that kind.
That's too bad. Horrible, horrible way to go. As long as you have insulin, you're fine.
Yeah, I have to give it to him.
But if you don't have insulin, your life can change in a moment.
But I wonder if I tried some of those supplements.
Absolutely. Turmeric and black pepper.
Be a lot cheaper than what I'm getting.
A lot cheaper, very common. If you get with me later in a non-official capacity, I can give you amounts.
For a cat.
Well, cat, it's going to be based off weight.
Wait, okay.
It's going to be based off weight. Type 2 diabetics. Out of that, it can be diet and exercise control. There's a lot of type 2 diabetics that make insulin and their cells are just resistant to it. So as long as they control their sugar intake and they diet and exercise, they can manage the diabetes just fine. Or we can flood it with insulin. Just make what is working work really well. Again, the problem with insulin is limited shelf life, limited storage. Cinnamon has been proven to be very effective on type 2 diabetics in lowering their blood sugar. And also, that same curcumin and piperine reset the cells' receptors so they're sensitive to insulin again.
Are they emergency solutions or long-term?
These are emergency solutions and long-term solutions. They've shown that if you start taking cinnamon, you can have blood sugar and hemoglobin A1C readings, blood tests, the test for diabetics, drop within a few days.
Take it in a tablet.
Take it in capsule form. Yep. Or in a mocha, or in cookies, or in whatever. Well, I don't know about cookies for a diabetic. But oatmeal, large quantities of cinnamon. And again, I'll give you amounts if you want to know them afterwards. It's not even that much.
So if somebody, say, knew that in their family that, say, type 2 diabetes appears every now and then, but they hadn't been diagnosed with it, with doing the cinnamon and the curcumin and the piperine,
The turmeric and pepper.
yeah, you do all that stuff as,
I use, who likes curry? You ever had curry before? Guess what's in curry? Turmeric and black pepper. There's a reason why a lot of the health diseases we have now didn't exist or weren't very prevalent 50 years ago. It's because we ate differently. So our bodies are responding differently. Food is medicine, medicine is food. Heal your body through diet. There's a huge holistic mantra that we keep saying over and over and over and over. You're noticing that a lot of these herbs that we're going to be talking about here in a little bit are all culinary herbs. There's a reason why there were culinary herbs back then. It's because they kept people healthy. Great questions. Any questions about diabetes? Again, what is the number one medical treatment for it? Insulin. If you can't get insulin, heaven forbid someone in your family runs out, there's no supply, there's none at the pharmacies, whatever, and you can't get your insulin, are there alternatives? Yes. I will never advocate that you only do the alternatives and not use the insulin. I look without a doctor's advice. Talk to a doctor if you're going to do stuff like that. Any questions about diabetes?
You probably all know that we have. Can you just tell it to us now?
I can't because we're recording it. All right, allergic reactions and asthma. You'd think that anaphylactic shock, allergic reactions, and asthma were different, but they're really not that different. They're actually caused by the same process in the body. It's histamine and inflammation. And so while they are different diseases and different conditions, they're treated almost exactly the same. So we're going to talk about them kind of together, but separately. So what we have here is called a mast cell. This is a type of cell inside your blood, and its job is to identify things that don't belong and release histamines and other things, leukotrienes, things like that, that get your body to attack it and get rid of it. So here's we've got a bunch of wonderful histamine releases going on over here. That histamine does certain things in your body. And one of the things that it does, we'll get to here in a few slides, is that it triggers different reactions in different parts. So it'll be opposite reactions sometimes. So first thing, for an allergic reaction, histamine is the bad guy. It causes all of the symptoms we're used to seeing with a true, not just an allergy like hay fever, but hey, I ate a peanut and I can't breathe, I'm going to die, kind of an allergic reaction. The swelling from leaky blood vessels, the itching from the nerve stimulation in your skin, redness, the hives from the blood vessels dilating and getting leaky and leaking blood out into the tissues. Trouble breathing from the muscles inside the lungs constricting so that air can't get in. That's their job, is to keep bad things from getting into your lungs. It's the body protecting itself. But if it left out of control, it's going to protect you so bad that it kills you. Which is what shock is. Again, shock is a body protective mechanism. We'll talk about shock here more in detail in a second. It's your body protecting itself. But if you don't fix the problem that's causing it, it's going to kill you. Crazy, huh? So histamine. So how do we get rid of histamine? Come on.
Use an antihistamine.
An antihistamine. What's a really common antihistamine? Guess what we give people with an allergic reaction on the ambulances and the ERs? Benadryl. In the IV. Okay? Can you get Benadryl in a person almost as fast as an IV without an IV? A liquid. And do what with it? Under your tongue. Okay? You put it under your tongue. And the blood vessels in your mouth will absorb that almost as fast as IV.
Can you come in those things you can put under your tongue anyway?
Easy, quick, dissolvable tabs for children that are 12.5 milligrams. I can give you these amounts because the FDA has approved those. 12.5 milligrams. 2 of them for an adult. Under the tongue.
But that's prescription.
Not prescription. Over the counter. From Walmart, Walgreens, Smith's, Lynn's. My cupboard. It will make you a little bit sleepy. Yep. All right, so here's what we're talking about. So one of the biggest problems that histamine does is that, you see how the blood vessel wall is nice and tight here? Normally a small amount of fluid leaks out. That's normal. When histamine gets a hold of it, the space between the cells in a blood vessel open up really big so that a bunch of fluid can come out. That's why it swells up when you get hurt. When you sprain an ankle and it swells up really bad, this is why histamine's been released and it's causing that swelling. So we can fix it with antihistamines.
You can fix a sprained ankle with them.
You can help it, yep. Histamine response is the same inflammation response, whether it's a histamine from an allergy, histamine from reactive airway disease, or from asthma. Histamine is histamine is histamine.
I asked the doctor if I could do anything for swelling, and he said no.
Oh, ice it, rest it, compress, yep. Takes
It'll
it.
take a year.
Oh, it's not going to take a year for the swelling to go away. Your body will fix that.
November, and he continually did fluid. Last month, they took 30 cc's off his hip.
Now that's different. That's not a histamine response.
Okay.
That's a joint capsule issue. That's a different thing. I'm talking, hey, I was walking and tripped and sprained my ankle, and I can't get my boot off, it's too swollen. It's a histamine inflammation-mediated response. And antihistamine will help decrease the swelling.
What other options do you have besides Benadryl?
Oh, parsley. I like parsley. Lots of fresh parsley. Oh, Brigham tea.
Brigham?
Yeah, the plant that grows around here, ephedra.
Never heard of it.
Oh, sorry. You guys ever taken a walk out here and you've seen these little plants with these long, kind of green, spiky with brown joints, and they look kind of funny, like straws?
Like a snake grass?
Not the snake grass. This is actually ephedra. Locals call it Brigham tea. It's a bush like sagebrush. Mormon tea, Brigham tea, whatever you want to call it. It's a plant called ephedra. In Chinese traditional medicine, it's called ma huang. If you take pseudoephedrine for your colds, guess where that came from? Ephedra. It's the same stuff. It works just like adrenaline does in your body. It's the same type of chemical. We cover it later on. Fun stuff. All right. Inside your lungs, however, histamine is going to cause the muscles that go around the tubes in your lungs to squeeze tight. You couple that with the blood vessels getting leaky from over here, and you get mucus and water collecting inside your lungs. It's this squeezing and that fluid collecting in the lungs of asthma patients and allergic reaction patients that causes that wheeze, that it's the air being spun around inside their lungs around these blockages. That's what's causing it. So in order to fix these things, we need to relax those muscles. We need to broaden that up. Antihistamines will do that. So your choices are catecholamines, big fancy word for adrenaline. So you've got epinephrine pens. Has everybody heard of an EpiPen for allergic reactions? Well, guess what you can also do? That Mormon tea, that Brigham tea plant. It's a wonderful local desert plant that grows here in abundance on the side of the mountains. You can walk it up, you can chew it. I do it camping half the time. I'm getting a little sluggish. I pick off a bunch and throw it into my canteen and heat it up and make a tea and drink it. And it's like having my morning coffee.
What do they call the plant?
It's called ephedra.
Help wheezing, it would help with that.
It will, what it does a similar thing, same action as epinephrine does. It will dilate that lungs. It's also going to constrict those blood vessels so they quit leaking.
You mentioned earlier cayenne pepper expanded your vessels.
Yep.
Would it also have effect on this?
If you give too much, yes. Oh, no. What you think is backwards. Cayenne's going to expand it.
Right.
Histamine's already expanding it. Cayenne's going to make it worse. It's going to make it go from expanded to, hey, I'm a fishnet. Everybody go through. Kind of like our borders with Canada.
I've driven across that.
Yeah, you don't want Canadians here. They say A all the time.
What's that?
And they watch hockey. What's that? Sorry, I'm from Florida. We didn't have hockey down there. Bronchodilators. Again, we're going to go back to that picture up here. The name for these tubes is a bronchus, or your bronchioles. You've heard of bronchitis. All that means is that these tubes are getting inflamed and they're closing down. So bronchodilators will open those up, like your albuterol inhalers that you see all your asthmatics puffing on, right? Guess what else? There's a wonderful plant called lobelia. Indian tobacco does the same thing. My wife about had a fit when the first time I made a lobelia cigarette for my youngest kid. Because I was experimenting, I was learning about herbs and things, and he had an asthma attack, and he went to go for his puffer, and I said, no. Lit it up and gave my son a cigarette.
But it has to be with Indian tobacco.
Yes, the lobelia is Indian tobacco. It's the same thing. It's the proper name for it. So he smoked the cigarette, and guess what? His asthma attack went away. It's the first time I've ever seen smoking fix asthma. I've since gone to a nebulizer. You get a tincture of lobelia, you drop a few drops into a water in a nebulizer or a diffuser, have them breathe in the mist. It works better. And it doesn't stink so bad. And my wife's happier, and it's not a gateway medicine. And then you have antihistamines. Benadryl. And you ask, what can we do instead of Benadryl? Yes, stinging nettle. And yes, it works fast. It's not an overtime build-up things. One of the things that I kind of specialize in with natural treatments is, because of my medical background, I wanted to find out a way to treat acute problems that are happening right now. I don't want to give supplements that take 2 months to work. I want to fix the problem now. Well, a lot of these do. A lot of them don't, but these do. Butterbur is another plant that has got wonderful, amazing antihistamine properties. Same thing, powders, roots, tinctures, teas, however you want to take them, they all work. And they all work rather quickly.
I understand my mother-in-law's poultice worked. It had lobelia in it. When
Yes.
They would get pneumonia.
In your chest.
She made a poultice that had lobelia.
Indian tobacco, put it right on there, and it bronchodilates, helps you breathe better. It's an expectorant, it gets all the mucus out. Wonderful benefits of lobelia for respiratory problems. If you mix lobelia and mullein together, oh, you've got a 1-2 punch that's incredible. The proper name for asthma is reactive airway disease, which just means that the person's lungs are super sensitive to stress, pollen, dust, dander, exercise. Anything that stresses their body is going to cause problems in their lungs. Yes, sir?
So all the stuff we just talked about had to do with allergic reactions, not asthma? Everything?
Correct, but again, like I said, they're so close, you can treat them the same way. So the things that you use for the allergic reactions, you're going to see a lot of the same things with the asthma. Because what are the same problems? Leaky blood vessels in the lungs causing inflammation, wheezing from the lungs constricting. It's all a histamine response. So can you give an antihistamine to an asthmatic? Yes. Is it going to help? A little bit. Is it going to hurt? No. It's the same problem. Their lungs, nice and healthy, nice and clean. The swelling from the histamine response from the pollen and the dust, whatever it is getting in their lungs, the exercise, the stress, causes the blood vessels to leak, and then the muscles contract. It's the same problem as your systemic anaphylactic shock. It's just localized in the lungs. So we can treat them the same way. Same treatments. People with allergic reactions on the ambulances and the ERs, we're giving them albuterol inhalers to clear their lungs. It's the same treatments for the same problems. So rather than thinking, hey, for this I give this, I want you guys to think, hey, this is what's going on in the body. How can we change that? There are more tools available to you, rather than you take this much, this many milligrams, this much, so much every day for this problem. That's all you can use it for. Be creative.
So if you don't have an inhaler handy, you can possibly substitute Benadryl for a short-term.
For a small effect, yes. It's not going to have as strong effect because it's going to take longer to get to the lungs because it has to go throughout the whole body. So yes, but is it going to help a little bit? A little bit. What's better is going to be putting something into a nebulizer and let them breathe it in, because then it goes straight to their lungs. So there's long-term acting stuff and there's short-term acting stuff. But yes, according to science, it should work. Any other questions? Good. All right, we've talked about shock a couple times. And I'm sure we're going over, what time is it, Mike? We gotta get a clock up here. 11:50, quarter till. All right, we got a little bit of time. We keep talking about shock and how dangerous it is for the body. What is shock? What does it really mean? All it really means is the body's not able to get oxygen to the cells, nutrients to the cells, and it can't get waste away from it. Your whole body, not just one part, your whole body is being affected by this. And it's actually your body trying to save itself. It's trying to save your heart, your lungs, and your brain. So it will shut down blood supply to everything else in your body. Your skin first, then your other organs like your stomach and your intestines, and then your kidneys and your livers and gallbladders, until all that's left alive is your heart, lungs, and your brain. The problem is, if we don't fix what started this whole thing soon, how long are you going to live without a liver and kidneys and stomach and intestines and skin? Not very long. So shock is actually our body trying to protect itself, triage itself. It's saying, hey, heart, lungs, and head, you're all red tags. The rest of the body, you're black tags. The problem is we like the rest of the body. We've grown quite attached to it. It's been with us our whole lives. So we want to try to save it. So how do you recognize shock? The first thing that's going to happen is that your heart rate is going to go up and your breathing is going to speed up. Now, other things can cause this, so don't freak out. You're not in shock yet. But your body's going to start to get all the blood in your body to the core, to your heart, brain, and lungs. So your skin is going to get cool and pale. Your blood pressure is still going to be okay. I'll be able to touch your wrist and feel your pulse still. Your blood pressure is one of the last things to go. You might get dizzy or have fuzzy thinking or confused. As it progresses, your heart rate's going to get faster and faster and faster. And your blood pressure is going to get lower and lower and lower because the blood is no longer going to your arms to take a blood pressure on. It's no longer going to your wrist. You won't be able to feel the pulse here at the wrist anymore. But they're still talking to you, but their blood pressure is getting lower and lower. Eventually they're going to pass out because as the body is trying to save itself, it's going to start cutting off even blood supply to the brain. It's going to try to save the heart and lungs because without those two, your brain can't survive. It's kind of weird how it does this. Again, your kidneys and livers are not getting blood, so they're going to shut down. Your blood pressure drops even more, and when that happens, you're at the point of no return. Your body is trying to save itself so much, it's killing you. That's what shock is. So to put it really simple, shock is just low blood pressure. So how do we fix low blood pressure? Stimulate it. You go back to some of those medications that we're using for the asthma that cause the blood vessels to constrict and everything. The biggest thing though is going to be fix whatever's causing the problem. Whatever the cause of the problem, whether it's bee stings, an allergic reaction, cold, dehydration, a heart attack, all of these things are affecting your blood pressure. And if it keeps getting lower and lower and lower, you're going to, bleeding is affecting your blood pressure. So whatever is causing your shock, there's all different kinds of names for it, but it's all just shock. That's the problem, low blood pressure. You gotta get the blood pressure up. If it's from nausea, vomiting, and diarrhea for 3 days and you've puked everything out and you're dehydrated, drink water. fluids. Get those fluids back into your body and it'll bring your blood pressure up. If it's a heart attack and your heart's not pumping, get that fixed so that your heart can pump correctly and keep your blood pressure up. If it's from an allergic reaction from a bee sting or shellfish or peanuts, fix the allergic reaction and the shock will go away. Yeah?
Can it also be caused by just witnessing a traumatic event and,
Mm-hmm.
and you send your brain into...
Really strong emotions are bad news?
Okay.
Believe it or not, our emotions affect our bodies. You can make yourself thick by thinking about it.
That's why the husband faints in the brewery room.
Yep. Oh my gosh, I had no idea. And that stress causes certain chemicals to be released that affects his heart rate. And it either goes too fast, so it can't pump blood, or it slows down and it can't pump blood. And he passes out. His blood pressure drops. That's exactly why. That's why, and it's always dads. How come moms never pass out like this? I guess they might. Hey, I got a tattoo. I got my ear pierced, Mom. Dad, I'm pregnant.
You seen Castaway?
I did.
And then she got the phone call.
And she passes out.
My husband it was Christmas Day, and you know those terrible packages that you can't get open? And he was using a pocket knife
Uh-huh.
to get it open. Stabbed that muscle in his thumb.
Yep.
He was okay for a minute. We covered it up. He
Yep.
finished what he was doing, went into the kitchen to dress it.
Uh-huh.
Bam.
Sometimes just seeing the sight of blood.
Convulsing. It was
Because his blood pressure dropped and his brain is freaking out. Hey, I'm not getting enough oxygen and sugar and I've got too much waste product building up. It's all about blood pressure. Okay.
You also, when you're in shock, shake, get cold,
Yeah.
and shake.
When you get cold, what happens? All your blood is shunting away from certain parts of your body. It's not getting to all of your cells. That's what shock is. You're going into shock physically. Hypothermic shock. There's all different names: cardiogenic, neurogenic, anaphylactic shock, neurogenic shock, hypovolemic shock. They're all shock. It's low blood pressure. Whatever the cause, you fix what's dropping the blood pressure, you'll fix the shock. Because if you don't fix the shock, you're going to die. It's your body protecting itself. One of the best things that we can do to prevent that whole process is early recognition. Recognize what's going on. Look for that increased heart rate, increased respiratory rate, that cool, pale, clammy skin. Look for those warning signs of shock and stop it early. It's way easier to stop early than to wait till the end when your kidneys are shutting down. And we might save your life, but you're going to be on dialysis and on transplant list for the rest of your life. Keep them warm. It's so simple. But when your body starts taking the blood away from your skin in that first stage of shock and you're getting cool and clammy, you're losing body heat. When you lose body heat, your body can't survive. Keep them warm. It's so simple it gets forgotten.
Hospitals put those heated blankets on you first thing.
First thing they come in, warm them up. We have a mantra: you're not dead till you're warm and dead. Okay, it's true. We don't let you die. We won't call a death until you're 98.6 degrees inside. But you've got to stop what's causing that low blood pressure, whether it's bleeding, replenish fluids, remove or treat the allergy, whatever's going on, or help the heart, whatever problem it's having. There are some medications and overdoses. I guess I didn't save that one when I made this. Medications and overdoses, or poisonings that can cause low blood pressure. Remember that nitroglycerin that we talked about? Blood pressure medications. Those can all cause low blood pressure. If you have normal blood pressure and you eat grandma's or grandpa's blood pressure medicine thinking it's candy, you're going to have shock. So whatever the cause, we got to fix the cause. But you got to identify what's causing it. Almost done. Some environmental problems. Generally speaking, at this level, I just want you to worry about a few. Waterborne issues, dehydration, overhydration. Yes, you can have too much water. It's called drowning. Hot and cold exposures, and then the creepy crawly stuff out there. a lot of the things that we're going to encounter when we start having water supply issues with any kind of, not even just disasters. Shoot, when the city works on the water pipes sometimes, they say, hey, don't use your water for 2 weeks without boiling it. Have you guys had that happen in your neighborhoods yet? Oh, I did. They were doing construction for the university and busted the water main and the sewer line. And they said, hey, don't use your water for a week. Boil it. Or better yet, don't use it. That was up in Salt Lake in West Valley. Poor Magna, that happens to them all the time up there in Salt Lake. They can't drink their tap water. They have to drink something else. Whenever that happens, your water supply is going to become an issue. You're going to have contamination from something if you're using other sources. Your pools, your bird baths, the streams, the irrigation ditches that run down the side of the road, even your faucet sometimes. There's going to be problems with it. Even the cleanest, purest mountain stream has got these in it. Anytime you've got someplace where people and animals are drinking from the same place, you've got the risk for Giardia and Cryptosporidium. And anytime you've got where something is pooping upstream from where you're drinking, you're going to have E. coli. So where does all of our water here in town come from?
Snow melt.
Snow melt, which goes down through the trees and the woods and the rocks and the streams. And where do all the deer and elk and rabbits and bears don't poo in the woods. Campers. None of them poo in the woods, right? All of our water is coming from the woods. Unless you live in Enoch, in which case we're all pumping it out of the ground, but it all comes from where? The snow, from the mountains. So that's why we treat all of our water, because our bodies are not used to handling Giardia and Cryptosporidia. They're protozoan parasites that cause a lot of problems, really bad flu-like symptoms, watery diarrhea, bloating, lots of gas, your stomach hurts really bad stomach cramps. So what do you do for it? Prevention.
Filtration devices in the other room right over here.
Yep. Prevention. Can you boil it? Is it going to be safe afterwards?
It helps, doesn't it?
Maybe. Depends what altitude you're at. Water boils at 212 degrees at sea level. Okay, it takes that temperature, 212, to make the water safe. Guess what temperature it boils at 5,000 feet? I have no idea, but I guarantee you it's not 212 degrees. It's going to be lower. It's going to be a lower temperature. It's probably about 170, 180 degrees is when it starts boiling.
Some of these places, they sell things that they say that doesn't have to be boiling water. Something like around 170 or 60 or 80, in which case it's good enough, right?
They say by the time it gets to that boil, it's safe. And it all depends on altitude. If you go up on the mountain where you're at 10,000 feet, it's going to boil at a much lower temperature.
Yeah, but in some of these things, they give you it's got some wax or something like this right here. Right?
Yeah, we have one.
It says 149 degrees Fahrenheit to make it pasteurized, free from disease and organisms.
And that's what we cook all of our food to, is 140, right? So again, it depends on your altitude.
Yeah, but here,
Here we should be safe, but I just want you to think about it, and boiling is not always necessarily going to be guaranteed to get rid of pathogens. And it certainly doesn't get rid of contaminants, like petroleum products, pesticides, stuff like that. So just boiling your water does not make it safe.
What about those tablets that they sell for putting in water to purify it?
Those work.
Against Giardia?
Mm-hmm. And they've got water filters that will filter these out. There's tons of products out there. Tablets, iodine, chlorine, filters, boiling it. There's lots of ways to make your water safe. But if you've ever taken a sip from a mountain stream without doing that, you'll pay for it later.
but not all filters do. The filters have to be really, really good for those Giardia.
Yep. It's usually got to be less than 0.5 microns, which is really, really small.
Our Sagans meet that criteria.
Yep. There's a lot of them, like the, oh good heavens, the survival straw, the carbon one that you've seen at like Walmart, where it's got the crinkle straw that you pull out, that you drink out of it. Oh, it's a water filter. It's a carbon water filter. It takes out contaminants like petroleum, fertilizer, pesticides. It does not filter out Giardia and Cryptosporidia. Bacteria and viruses.
Along the same lines, did anybody see the news where they said radium is a contaminant they found in water now, pretty much across the U.S.?
Yeah, not just radium. Who's ever taken an old bottle of pills and flushed it down the toilet? Uh-huh. Yeah, thanks. Because guess what we keep drinking? That recycled water. They have found so many pharmaceuticals in our water supply, sugar, all these aspartame, saccharin, all these artificial sugars we created are all in our water supply now. Everywhere, every well, every water aquifer in the entire country, and in most of the world. It's all contaminated with that now. There are almost no pure sources of water anymore.
No wonder there's autism and all that kind of crap.
Yeah, we're drinking a greater pharmaceutical cocktail than any street in Las Vegas can sell you. It's crazy. Water safety. So it's not just Giardia and Cryptosporidia, it's E. coli. Make sure that you're using the restroom or whatever far, far, far away. The minimum is 100 feet. It's not near far enough for as far as I'm concerned. Get it as far away from your water supply as you can. And then hope whoever's upstream from you. And one of the reasons why I think California's got so many problems is because they're downstream from over half the country. Right? They got terrible water. It's all about their water. How can we take care of it? Fluid, fluid, fluid. Whenever you have these water-related problems, guess what the cure is? Water, because you're going to get diarrhea. Really bad. And when you get diarrhea and vomiting, you're going to lose all the water in your body. So we have to stay on top of your fluid and your electrolytes. The Brady diet, or Brady, however you want to pronounce it. It stands for bananas, rice, applesauce, toast, and yogurt. Generally speaking, when you've got really bad diarrhea from whatever the cause, if it's viral, it'll go away in a few days. This will help it. If it's bacterial, it probably won't go away in a few days, and this will help it. If it's caused by protozoa like Giardia or Cryptosporidium, this is going to help it. Bananas, rice, applesauce, toast, and yogurt. The reason why, and it used to be called the Brat diet. The reason they added yogurt to it is for the acidophilus bacteria, to replenish the bacteria inside your gut to help stabilize the diarrhea. There's all different kinds of different things. The most common over-the-counter medication you can take to stop diarrhea is called loperamide or Imodium. Same thing. Some herbal alternatives are raspberry leaf tea. Does a wonderful job of stopping diarrhea without constipation. Stinging nettle tea is on there because it has got all the electrolytes that you need to replace. When you're replacing electrolytes, we're talking sodium, potassium, magnesium, and calcium. Gatorade has got it. Any sports drink or Propel or anything has got it, but it's got so much sugar that it makes the diarrhea worse. So I don't recommend the drinking Gatorade when you have diarrhea. It will make it worse because of the sugar. So if you drink Gatorade, water it down with water. At least half and half. Otherwise, it's just way too much sugar and it's going to make the diarrhea worse. You can also take supplements, drinking them. This is for food-wise with it. Colloidal silver. It will help kill the Giardia and Cryptosporidia and the E. coli if that's what you've got a foodborne or waterborne contamination issue. And the same thing with the rosemary and oregano essential oils. Or just cook with them. They're delicious.
I have a question about colloidal silver.
Yes, ma'am.
I don't understand. I was in here the other day when I signed up and I saw there was a system for making your own
Mm-hmm.
silver water. What about heavy metal poisoning?
It's not a heavy metal.
Oh, silver is not? Okay.
Your heavy metals are things like mercury. Lead, way down on the atomic scale.
Okay, so gold is not?
Gold is not. Not just so much the weight of it, but the atomic weight.
My son helped Temple and did some of the gold leaf,
Uh-huh.
and he could rub it into his face.
Yes.
It would go into his skin. And I thought,
It's okay. There's a reason why all your high-performance sportswear has silver woven into it now. Is because it's antibacterial, antimicrobial. It helps with the odor, it helps with the stink, it helps with health-wise, copper, silver. That's the two most common ones people use that have health benefits, that are actually beneficial to your body and you're helpful. So no, silver is not a heavy metal. It's not going to get heavy metal toxicity from silver at all. Do be careful that it's not, just like anything, it's not the amount, or it's not what you take that is safe or dangerous, it's the amount you take that is safe or dangerous. If you drink a gallon of colloidal silver, is there a chance you'll get the gray skin, the blue skin? Not really. You drink 5 gallons, 10 gallons, well, yeah, you're probably going to get a kind of gray tint to your skin. On a daily basis. It's a lot of colloidal silver. It's very rare for it to happen. But your body can have problem getting rid of it. So I don't recommend it to everybody. Carte blanche, take it, it's wonderful stuff. No, take a little bit, see if it works for you. Each person's a little bit different. The most commonly prescribed antibiotics for Giardia and Cryptosporidia and E. coli, both, all 3 of them, is Cipro and Flagyl. These are prescriptions. There are ways to get them without prescriptions. I don't recommend it unless you know how to use them. And even then, I don't recommend it unless you know when to use them. And even then, I don't recommend it unless you know when not to use them. Switch in the 3rd class. We'll talk about those. These are also last resort treatments because the resistance to some of these antibiotics increases the more and more we use them. So even doctors don't like to use this. They want you to do the Brady diet and the loperamide first because your body will fight these things off eventually. It just may take time. But if you're getting really dehydrated and having to do IV therapy to get your fluids back up, they'll start using Cipro and Flagyl. Here's the electrolytes we're talking about. It's actually recommended in a desert environment like we live in that we drink 6 to 8 liters of water a day. That's anywhere from 1.5 to 2 gallons of water a day. That's normal required water intake. If you're not drinking that much, you're dehydrated. And if you are drinking that much, you're probably low on electrolytes because you're going pee every 2 hours. So the electrolytes you want to watch out for is your sodium, potassium, magnesium, and calcium.
That's what you need more of.
Yep. Generally speaking, the more that you go to the bathroom, you're going to lose sodium and potassium both. Some medications will affect your magnesium levels and your calcium levels, but mostly it's going to be sodium and potassium. So you want to get a good amount of sodium and potassium every day. The other electrolytes that everybody forgets about are chlorine and sulfide and all that kind of stuff. And the reason why they forget about them is because they're all attached to these 4 ones. Sodium chloride is table salt. Magnesium sulfide is Epsom salts. Potassium chloride. These are all salts and things that we drink and eat every day in our food. So make sure you're drinking enough water. But again, here at this altitude, in our environment, we should be drinking about 2 gallons of water a day, which means you need to be eating enough fresh fruits and vegetables and greens, green leafy vegetables, to get all of your electrolytes. And if not, drink a Gatorade if you have to.
Which reminds us when we're talking about we say 1 gallon a day per person, for 1 gallon per person per day. That's bare minimum. You're already into dehydration.
And that's not even drinking. FEMA recommends that for hygiene and food preparation and everything. So you really think I need 2 gallons of water today for me to drink, at least 1 gallon of water a day for me to wash and prepare food. And that's not doing personal hygiene stuff. That's just washing sanitation-wise. I estimate about 5 gallons a person. It's always better to have more than you need than not have enough. And here's the last one or two. heat exposure. Sweating is cool. It's all right to sweat. As long as you're sweating in the heat, you're fine. Your body is cooling itself. It's doing what it's supposed to. The second you stop sweating in the heat, you've hit heat exhaustion. And the next step from that is heat stroke. And the next step from that is a view from a rectangular container that everybody, cries over and says, we loved him so much. Or, wow, he was such a jerk. So when you stop sweating, that's when you should really start worrying in the heat. And it's really tough to gauge that here in the desert because it's such a dry area. Our sweat evaporates really fast. So check your clothes. Make sure that you're sweating. If you get to the point where you start getting cramps and things like that, the best way to fix dehydration is through oral intake of fluids. They need to be room temperature or as close to body temperature as you can. When you drink cold liquids, your body has to warm it up before the sphincter in your stomach will open and let that go into your intestines. So that it may feel nice to drink that ice cold something, but you're not going to get a benefit from it for about half an hour to an hour until your body warms it up, then it can use it. So if you're worried about dehydration, drink room temperature or slightly tepid liquids. Water is great. It doesn't have electrolytes. Pickle juice, on the other hand, does. I freaked my kids out one time because I was working outside in the yard and I came in and grabbed the jar of pickles and straight from the jar, grossed my daughter out, just chugged about 3 or 4 cups of pickle juice. And it tasted sweet because I was so low on electrolytes. Your body will tell you what it needs. Pickle juice is a great source. 50-50 water or sports drinks. Any questions about heat exposure? And how to take care of dehydration? What is the number one key to take care of dehydration? Hydration. Drink more water. The guys over in Iraq and Afghanistan hated us medics because they'd come to us with, hey, doc, I got this really bad. And I'm like, drink more water. I know. Drink more water. It became a joke over there, but really the solution was drink more water. They're all dehydrated. They were low on electrolytes. So drink more water.
Can you be peeing every 2 hours and still be dehydrated?
Yes. Listen, my wife, she says, Josh, I go to the bathroom all the time. And it's the same color coming in as going out. And I'm thirsty all day. Then keep drinking water all day. But can you get overhydrated? Yes. You can drink too much water. If you're not replacing those electrolytes, you're going to get what's called hyponatremic, not enough salt in your body. It'll cause cramps, dizziness, diarrhea, body aches, weakness. You got to watch both hydration and electrolytes together. So it's a 1-2 punch. You can't have too much water. I had one guy over there when I was in Afghanistan, and he said, all right, doc, you said drink lots of water. I drink 6 gallons of water and I feel terrible. I'm like, yeah, go drink a Gatorade. Get some electrolytes in there. He went and had a Gatorade and felt better. I said, keep it down to about 4. Don't go above 4 gallons.
At our warehouse, we also have something called concentrates mineral drops that I prefer over Gatorade.
Yeah, Gatorade's horrible. I'll tell you more afterwards about the origin of Gatorade if you're curious. Any questions about heat exposure? All right, frostbite and I call them frost nibbles. It's the same thing. Shivering is good. As long as you've got someone who's in a cold environment and they're shivering, their body is trying to keep itself warm, that's good. They're actually not bad off. They're cold, but they're medically speaking, they're fine. It's when you stop shivering that you're hitting hypothermia, that you get that sleepy feeling, I just want to sit down and go to sleep. It's when you stop shivering that your body is no longer making heat, that you can die from cold. So as long as you're shivering, just think, I'm still alive, I'm still alive. And as long as the people you're taking care of are shivering, they're still alive. When they stop shivering, that's when it's a problem. Don't warm them up fast. If you take all that cold blood, that's been in their hands and their feet and their skin that the body is shutting down to keep the warmth in to survive. Remember that whole shock we talked about before? Is trying to save what's going on inside. If you take all that cold blood and put it inside, their body temperature is going to drop.
May sound like a dumb question, but
Sure.
How do you recommend to warm a person up?
Slow with a blanket or a snuggle.
How body temperature, body contact?
Warm them up slow. Increase the temperature of the air around them. Conserve what body heat they are doing. Those little Mylar blankets, they're perfect.
Some people will be inclined to turn on the hot water, for an example,
Oh.
to warm up their hands.
Don't do it.
You should turn it on to cold water first, and let that feeling come back, and then gradually bring it up a little bit warm, never go to hot.
Yep. Do it slow. Because if you think about it, if you're outside and it's, our temperatures have been down in the teens lately. So if you're outside, your hands, my wife hates it when I do it too. She's warm. And my hands are cold. So right there on her lower back goes my hands, and it's cold, but it feels like an oven to my hands. It's all about difference in temperature. So cold water from the tap out of Utah is about 60 degrees. That is plenty warm enough to warm your hands up, because your hands are 20 degrees. If you put it on 80 degrees, that's like a huge temperature difference. It's going to feel, you'll actually get burns from it. So warm them up slow. Blankets, warm air, body heat, whatever it takes to warm them up slowly. Don't use hot packs. Don't do it. Don't give them a shot of alcohol. My grandma used to always say, if you're cold, sweetie, I'll make you a little hot toddy. That's whiskey and honey. And, it warms you up because it causes all your blood vessels to dilate. And you're going to lose more heat that way. So you're actually going to make your body temperature worse with alcohol. And if you do get frostbite where something is frozen, hard, and solid, don't thaw it out. One, it's going to be really painful. And if you do thaw it out, don't let it refreeze again. Who's ever had a steak that you brought out of the freezer, you thaw it out, and then changed your mind, or a roast, and you put it back in the freezer, and the next time you went to use it, it was kind of mushy? The same thing is happening with frostbite. What is literally happening with frostbite is that you have a cell. And inside that cell are snowflakes, ice crystals that are all sharp and pointy. And as you get more and more crystals forming, they poke holes in the cells of your body. And when it thaws out, it leaves holes in it. It kills them. If you freeze it again, you're just making it worse. So if you've got somebody that you think has got frostbite, it sounds weird, but don't thaw out their feet or hands. Keep them cold, because when they thaw out, they're going to hurt. Who's ever come inside from the cold that had your hands or your ears just burn like they were on fire? Yeah, the same thing is going to happen to people with a frostbite. So wait until you can get to medical attention before you thaw those out. Keep them frozen.
At what point, I've seen frostbite victims with like their skin turning black.
Yep.
What's that all about?
It's necrosis. It's actually dying. So, CO2, that waste product we keep talking about, is what turns your blood blue in your veins. It actually really is blue. Your veins are all clear. That blood in that frostbite area has been dead for so long that the CO2 has built up so high that it's turning black. It's like a big bruise. All that blood.
That's like a case where you said, don't thaw that out.
Don't thaw that out. It's dead. It's not, the stench, the spirit is gone, but the stench remains. It's not coming back. So the stage before that is when it turns kind of white and waxy, like hard like a candle. That's probably going to come off too.
So say that does happen, what gets released back into the body?
Well, if you warm it up, you get a bunch of cold blood You get a bunch of this CO2 and a bunch of that just dead stuff from inside the cells that leaked out is going to get returned to your bloodstream, and it goes to your heart and it can stop your heart. It's really not good. So in cases of really severe cold injuries where you've got frostbite, leave it frozen. Do what you can to keep them warm, but leave the frozen parts frozen until you can get to help. And if you do thaw it out, do it real slow and get ready for them to be in a lot of pain. Yeah, because that's probably all going to fall off. I had this wonderful gentleman, he was up in Salt Lake, and he came into the ER. This wasn't one of my patients, but I heard about it and saw pictures of it, which was really cool. He had frostbite so bad that when they pulled off his boot, it was bare bones at the bottom. There was no meat left because things had eaten off the dead flesh. So it went to about right here at his ankle, and then it was meat and skin above his ankle, but below that it was just like a skeleton bones. And he didn't know because he hadn't taken his boots off in over 1.5 years, 2 years, something like that. He had frostbite. You're going to lose that meat. It's frozen. It's not going to come back. It's not going to be viable. A lot of times it'll just peel off the outside layer and the inside layer is still good, but usually it's all going to be gone. Yeah?
No, I was just, he hadn't taken his boots off in a year.
He said, yeah, he was a homeless guy. And he said, yeah, it hurt for about a few months, and then the pain went away, so I just didn't worry about it. But you're going to encounter stuff like that with frostbite. Frostbite is going to be the same way. The tissue that is black or that hard white wax like a candle, it's dead tissue now. It's frozen. It's going to hurt when you try to thaw it out. So try to leave it frozen if you can until they can get really good medical attention. I don't recommend anybody ever do a field amputation. Okay. Last one. All right, creepies and crawlies, spiders, scorpions, bees, wasps, and snakes. The only 2 spiders you need to worry about really are the brown recluse spider. Have you guys heard about that one? Do you know how to recognize that one?
Are they around here?
They are around here. Yeah, violin shaped on their back. So you've got the main part of the spider. You got the thorax and all the little legs coming off, right? On their back is going to be a shape that's black, like a violin or a cello on their back. They've got really long, thin legs, a very small body, and but right on their back is that violin shape. It's the brown recluse spider. The way that it survives is that it injects a poison when it bites you that turns its food into liquid, and then it sucks it all out through a straw. What that does to us is that it turns us into liquid. And if not taken care of and treated, yeah, it'll dissolve our whole bodies because the bacteria, it's actually bacteria that it injects, will keep growing and growing and growing and growing and growing. So what you'll see is a red ring around a black spot where you've been bitten. That's how you know it's been a brown recluse. Right off the bat, it's brown recluse. There'll be a red ring around a black spot. And that black spot will get bigger and bigger and bigger as time goes by.
So how do you treat it?
I'll tell you in a second.
Did you say that was black, the violin part?
The violin is it's dark brown, black.
Darker than the rest?
Yeah, the whole spider is kind of a light brown. But that violin is black or really, really, really dark brown. And the other one is the black widow. Everybody knows that one, right? How to tell those apart?
They're very popular out here.
Yeah, hugely popular. They have got the huge thorax with these little legs that come out. And on the bottom of their belly, whoops, is that red hourglass. And that's only the women. The men are just all black. They're cooler. But not a lot of those survive because the women eat them. But there's that red hourglass on their bottom. But the really big hallmark that makes them really easy is that their skin is really shiny black, like polished, almost mirror finished black and shiny. And they have this huge old ghetto booty in the back.
Yeah, hobo spiders here?
Officially, no. Hobo spiders. Officially, no. Just like we don't have bark scorpions here, which is the next one coming up. Officially. You talk to Fish and Game and Wildlife and Resources. No, they're not up here. Yeah, they're up here. Yep, they sure are.
What is the venom of the black widow?
It's actually, it affects your heart. So it'll feel like a heart attack. So the same thing that we're going to do for heart attack victims, you might want to consider to do with a black widow victim. But generally speaking, neither one of these is fatal right away. It makes you really, really sick, but not usually fatal right away.
What does a black widow spider bite look like?
It'll just be a red ray spot. It may or may not have two little puncture marks like fangs. But it'll be about the size of a dime, and it'll be red bumped and swollen.
I was just gonna say the black widow webbing is very distinct too.
Yeah.
It's shiny and it's sticky and almost matty if you put a stick into it, and it kind of clings to it.
Yep.
Much more so than other spiders.
It's not your traditional spider web.
No, it doesn't look.
Yeah, you kind of wave your hand through and it falls apart. It's pretty tough and it's sticky.
I don't like that you have to grab them and pick them up and look at the bottom to see if there's one hourglass.
Well, that's why you look for the great big old bud on the back. And it really is this huge black shiny bottom that is like, oh, you don't need to see the hourglass, because they said the male spider doesn't have the hourglass. So
Black and shiny.
it's just black and shiny. If there's a spider in my house, everything has its place. I don't go in their house and bite them. Scorpions. We do have the bark scorpion here in Utah. But they say it's not here. But until my son brought one home from playing with his friends on Lay Hill, I didn't think we had them here either. And then I said, oh, well, no, that's a bark scorpion. The thing to remember about scorpions is no matter what kind of scorpion it is, it's going to burn when it stings you. The other thing to remember about scorpions is that they're arachnids just like spiders. They have 8 legs. The stinger is this end, and the ones that have teeny tiny thin pinchers are the dangerous ones. They have small pinchers because they rely on their venom from the sting to kill and paralyze their prey. So the bark scorpion, if you're bit by several times, can paralyze your lungs until you don't breathe. But it takes about 2 or 3 stings, generally speaking, on body size for an adult. Children, on the other hand, a bark scorpion is enough to stop their lungs. It's a paralyzing venom. The bigger and uglier and nastier those claws look, the safer and safer the venom is. Because they're using their claws to catch their prey and eat their prey. So the bigger and nastier the scorpion is, let your kids play with it. Go ahead, it's fine. It's the little teeny tiny pinchers that you need to watch out for.
So they have multiple stings. They can just keep stinging.
Yep, right back here in the back is a venom sac, and they will inject a little bit, and a little bit, and a little bit each time they go.
How big is the bark scorpion?
About 1.5 inches to 2 inches big. They're little. But again, it's so potent that one sting from a bark scorpion, and I should have put a picture up here of a bark scorpion. It almost looks like a brown recluse spider. It's that same kind of brown with a dark line down the center of its back. It's not fiddle shaped like the brown recluse spider, but it's a dark brown stripe down the center of its back. And they're about 1.5 inches to 2 inches long, and that includes the tail. They're not very big. Teeny, tiny, thin little pinchers. So if somebody gets stung by a scorpion or a spider, try to see it. Usually it's pretty close by when it happens, and you know right away when it happens.
They like moisture, so they're attracted to the water. We had a water leak in our basement, and that year I found a scorpion tangled in a black widow web in my window.
Oh, nice! Because usually they fight. Scorpions and spiders don't get along.
You said the bark scorpion is really small, like 1 inch?
1.5 to 2 inches big.
They really like, in Arizona, they love the bark of the palm trees.
Because they blend right into them.
Yeah, they had to take all of our palm trees out around the church house because there were scorpions in the nursery. And they found them, they were in the palm trees there in the bark.
About the size of
Is
the
that why
body,
they call them
really.
bark scorpions, because they like bark? Sure they did.
I'm not sure, but they blend into trees really well, and I think it's why they like bark. Apparently, it's their favorite habitat. And I'm waiting to tell you how to treat all these because you treat them all the same. Bee stings. Bees and wasps are different. Okay, they may look the same, but they're not. They're very different in how they deal with stinging things. A wasp has a stinger that is hard attached to their bodies, and they can sting over and over and over and over. So they're not very dangerous because they don't inject very much venom when they sting. It's a little bit over a long period of time. It hurts. But when you have a bee allergy, it's usually not to wasps. Wasp stings are fine. It's to the actual specific bee venom. Bees, on the other hand, have a barb on their stingers. And when they sting you, it sticks in your skin and it pulls the venom sacs out with it. All of its guts and stuff. The bee is going to die. It hates you so bad, it's going to die to hurt you. The problem is the muscles around those venom sacs will keep working after it's stung you and will keep injecting venom into you until they're empty. So if you get a bee sting, it is very important that you get some sort of smooth edge something, credit card, something, and scrape it across to pull out that stinger. Do not try to pinch it out with tweezers or your fingers. You're just going to squeeze the venom sacs and push more in. But if you take something and scrape it along it, it'll pop right out. And it'll look like a little red area with a black dot in the center. That's about it. But it can take as little as one sting for somebody who is allergic to bees to really having a full-blown shock allergic reaction to it. Ready for snakes? Who likes snakes? I love snakes. I think they're fascinating. I like spiders too. Snakes don't inject venom all the time. An adult snake is going to bite you to tell you to go away, leave them alone. They only inject venom when they're hunting and trying to kill something. So most snake bites are what we call dry snake bites. There's no venom. And you'll know right away whether you've got a venom snake bite versus a non-venom snake bite. A venomized snake bite, as soon as you're bitten, it will feel like the limb wherever they got bit is on fire. And it will start to turn red and swollen within a minute. You'll know right away if it's a real venomization snake bite. A dry snake bite will hurt, it'll ache, it'll sting, but it's not going to swell up and turn real big red, and it's not going to feel like it's on fire. The exception with most snake bites is young snakes. The smaller the snake, the younger it is, and they haven't learned to control the venom in their snake bites yet. So when they bite you, everything is going in that they've got. They're dumping everything in. So the chances if you're getting envenomated by a small snake, a young snake, is really high. But like scorpions, the bigger, nastier, the scarier the snake is, the less likely it is to have venom in it. Anti-venom is very expensive. It's about $20,000 a dose, and you usually need about 3 to 4 doses of antivenom. It's used so little that Dixie only has 1 dose. Vegas, I think, has 3 doses. So if you get bitten by a snake with a real actual envenomation, it's very rare to get venom from a snake bite. They're usually just biting to tell you to go away, leave them alone. If you keep messing with them, yeah, they might bite you with venomation. But usually your snake bites are dry. So you don't need to worry about it. But you need to get that antivenom within a few hours. So this next part is really important because all of these are treated the same way. For your scorpions and spiders, baking soda. The alkaline baking soda actually breaks down the venom of spiders and snakes. It actually pulls it out, and charcoal helps pull it out of your body and your skin. And the Indians learned a long time ago that echinacea destroys rattlesnake venom. It's kind of funny. It's not just to boost your immune system. You make a poultice, and I'd say a poultice is where you take either the powdered herb itself and you mix it with honey or something, clay. Bentonite clay is a great thing to mix it with. Flour, mix it with something, and you get it moist, and you just put it on it and put a Band-Aid over it. Let it sit there. The baking soda and charcoal together will deactivate the venom from the scorpions and the spiders. It doesn't work as well on the brown recluse because that's a bacteria. But any other spider bite, black widows, bark scorpions, doesn't matter. Breaks it down. The only real fix for brown recluse is surgery. Cut it out. That's unfortunate, but that's probably the best thing for it. Yes, ma'am.
So the charcoal needs to be the
Powdered.
food grade.
The powdered food grade charcoal. If you don't have that and you're out camping or something, grab it straight from the fire and grind it up as fine as you can. Mix it with water, stick it on there. It's a wonderful drawing agent. It will actually literally pull the venom from the sting out of your body into the charcoal.
So you mix them with water, the baking soda and charcoal.
Make a paste, stick it right on it, and put a Band-Aid, a cloth, something around it.
I didn't know you could get powdered food grade charcoal. Is
Mhm.
that like in the grocery store? Or
I haven't seen it in the grocery stores, but a lot of the health food stores will have it. Yep. Same thing for the snake bites. For the first 24 hours, just charcoal. Again, this is another one of Dr. Christopher's wonderful creations. He says just do the powdered charcoal for the first 24 hours. After that, you take bentonite clay and echinacea and mix them together and put it on it, and it will finish drawing out the rest of the venom. It will actually neutralize the venom, which is awesome. So while you're headed to a hospital to get the antivenom, put some baking soda and charcoal on it. It's never going to hurt, and if the old wives are as smart as they think they were, it'll help.
So for snakes, baking soda also helps?
No, just the charcoal.
Oh,
what
okay.
is that, EO?
Oh, sorry, EO is essential oils. And those things are kind of really commonly available all over the place. But these are pretty much the main general medical issues that you're going to encounter in not just a disaster, but everyday life. And hopefully it's giving you a little understanding of what they are, what's actually happening, so that you understand it better, and then what you can do to affect and help change while you're on the way to the hospital. Or if you're in an environment where there is no hospital, you know that you've got some options. So any questions? like I said, today was less hands-on, more information foundation. The next class is, we're going to be on the floor a lot for the next class.